And it's important for people to understand that if you do want systemic change and you want to have good health care, have a place to live, have a job that you enjoy, be able to vote, be able to travel from point A to point B, these are just basic human rights that all people are entitled to. But what we see is that the physical health care and the mental health care is one of the factors that are really marginalized and disenfranchising people with disabilities, especially those from neighborhoods where people of color live. If you look at most of the hospital closures within the 5 boroughs, because that's what Sydney serves as the 5 boroughs, we notice that a lot of these neighborhoods that are being affected by loss of hospitals or services, especially mental health services, are pretty much in areas where people of color or people with disabilities or seniors are living. The impact that Beth Israel, as well as the New York I&E Infirmary, if they close, what the impact of that would be on the population. It's important to know that especially the New York I&E Infirmary is the only sensory hospital within New York City that's still left because everything else is closed. What will happen to those that go there for their vision and hearing assessments, people that went there to get evaluated for any throat issues? There's no other hospital that does the great work that this institution over 200 years have done. It's not about if you're a Democrat or Republican or independent. Disability is one of the things that can happen to anyone at any time. This is why it's important to understand the impact and understand that the one thing that really dictates is economics. Because unfortunately, for some disability types, you may be unable to work the way you used to. And that also lowers your level of options if you don't have the financial resources to get the goods, services, and materials that you need. Sydney does a lot of great work. It's been around since 1978. It's been part of the deinstitutionalization movement, the independent living movement, where we wanted to get many people out of institutions, nursing home, adult care homes, to live independently in the community. And they did a lot of great work. The disability movement has done a lot of great work to do that. What we found, especially going through the pandemic, is that the ones that were living in institutions were the first ones to go. So it's important to have the services that a person will need, especially if they require home care. Home health aides are essential to sustaining the day-to-day activity, the day-to-day life that allows for a person not to be in a nursing home, allows for the person to live within the community. And even these services are being cut by very greedy people, let's put it that way. We must remember not to put good health care over profits, and we must remember that as the population ages, we all are going to have a disability one day.